1 minute, everyone. All right. Greetings and welcome to our Juneteenth panel discussion. My name is Dr. Charlotte Smith, and I'm assistant professor at KU School of Medicine in Wichita in the Department of Population Health. I am also the co-founder of the Kansas System Brothers for Healthy Infants. The other co-founder is Dr. Michelle Redmond, who is also an assistant professor at the University of Kansas School of Medicine in the Department of Population Health. We welcome you to the Birth Equity Black Voices Matter panel discussion. We're so glad that you joined us. Black women and infants are more than twice as likely to die during birth than their white counterparts. This is partly because of the structural racism within the healthcare and community systems, and partly because we do not listen to Black women. These disparities have a long-lasting impact on Black women, men, children, families, and society. So today we stand together to tell you that we will no longer attempt to address maternal and infant disparities without the voices of the Black community, which means we will listen to Black women. During this panel, we want to spark the conversation by unpacking the traumatic experiences of health inequities and structural racism in our community. Our speakers, our panelists, will illuminate how stress, racial discrimination, and health inequities impact the Black family. Additionally, we will discuss the resources available to Black families. And finally, we will close with a call to action in our plans to develop a Kansas Birth Equity Network in Wichita, Kansas. Before we get started, I want to do a little housekeeping. This is a panel discussion, so please ask your questions. We're here to answer them and to spark that conversation. You can paste your questions or place them in our Q&A or in the chat box. You can also raise your hand to ask a question throughout this panel discussion. Dr. Michelle Redmond and Kyla Morris will be monitoring those. We will take a break to answer your questions because your questions are important to us, and that is why we are here. We will also have a particular area or time within the end of our panel discussion to answer your questions. So we welcome all questions during this time. First, I'd like to introduce our panelists to you. When I introduce them, please smile. Angela Scott. Angela is a community educator, advocate, and champion for life students. Angela is the mother of a beautiful daughter, Stella. She continues to serve her community as a professional academic advisor and a volunteer with several nonprofit organizations and a community educator. Angela is also the community lead for the future Kansas Birth Equity Network. Chris and Anya Barnett. Chris and Anya have been married for 12 years and have 4 beautiful children. Motivated by passion and personal experiences, Anya advocacy centers around Black womanhood, preventing and reducing fetal and maternal health disparities in the Black community. Chris' support and advocacy for Black fathers reframes this discussion to empower Black fathers and partners to help increase positive maternal health outcomes. We're so grateful to have Chris with us tonight. Sapphire Garcia Lease. Sapphire is a professional birth doula and founder of Sacred Doula Services, a co-op of women of color focused on serving birthing families in Wichita, Kansas. She is also the president of the Wichita Birth Justice Society, whose mission is to eliminate racial disparities in pregnancy. Jaylene Sims. Dr. Sims is an OBGYN and trained at the University of Mississippi Medical Center, the only OBGYN residency program in the state. She is employed at the Jackson Hands Comprehensive Health Center, and she is the newly named Associate Program Director of Wellness, Diversity, Inclusion, and Equity. And in her spare time, she trains medical residents in delivery and surgery. Welcome our panelists. We're so grateful to have all the experts and advocates at the table tonight. We will start our discussion with our first question, and we will start with panelist Angela Scott. To help our audience understand concerns of Black pregnant mothers and fathers in Sedgwick County and all over this nation, share with us the major concerns and disparities that Black women and men face daily.
Wow. Well, let me just help frame it. Every day in this country, every day in Sedgwick County, a Black woman, a Black child dies in childbirth or before the age of 1. The experts here will share with you the statistics. They're available on Sedgwick County's website. They are abhorrent for an industrialized 21st century nation to be losing groups of people, namely Black women and children. I would say it's unacceptable. However, it is definitely has historical precedent. And I dare say it is that historical precedent why we have not remedied these numbers. So if you want to understand what that's like, I'll share my personal experience. I'm a Black woman under 40 with 1 child, and I dare not have another one, lest I test the odds. It is very likely that I could not come out of that beautiful, beautiful experience alive or well, or even bring a child to term. Not because of my own misadventures or because I wasn't well-intended, and not because other people in the healthcare system were not well-intended, but because in Sedgwick County, much like the rest of the world, there exist racial disparities and inequities in all of our systems, including our health system, that regardless of the input, no matter how early you went to see your doctor, even though that's something you need to do, it's preventative, no matter how on top of things you were, you could still come out dead. Regardless of age, socioeconomic status, it is because you are Black in America and our health system, like our other systems, has not decided to remedy historical precedent that said our lives were not valuable enough. Now, let me be clear here. I am not saying anybody's standing up saying, I won't treat you, I won't treat you. You don't have to. People who started our medical institutions, people who teach our physicians, people who train them, don't train them to talk to you. Don't train them to how to treat African-American bodies, women in pregnancy. So that's one side of it. If we look at our communities, look at the disparities that exist there. What is the environment that Black pregnant mothers, that children are in? How much of that is a part of systems that are not set up to care for us appropriately? And so for me, it is a must that we raise our voice on this, particularly in Sedgwick County, when I think we don't rank high in a lot of things, but infant mortality is one of them. And we shouldn't be okay with that. We shouldn't be okay with those numbers. And we, as the African-American community, as mothers, as fathers, as sisters and brothers, all in this, should be concerned and should be asking questions. And we should be sharing our stories with each other. Because what I found is that when I started speaking with other women, other Black women, I found that, again, our stories were very similar in our care, the quality of that care, and the way in which we play a little game of roulette every time we decide to have a child. This is mine. She made it.
Thank you so much for that response and your passion and your work in the community. Dr. Sims?
So when we care for underserved women, we have to consider the social issues that affect the patient in many ways. So for instance, some offices don't take late patients, but we fail to consider the fact that getting rides or reliable childcare or work or whatever the reason may be reasons why the person was late to their visit. And in the realm of COVID-19, people can no longer bring their children to visits. So think about the fact that they may have to wait on a ride and then also wait on childcare, and then they can come to their visits. Just an example. So when we send a pregnant woman away from her OB visit, that could have been the moment that we missed the hypertensive disease of pregnancy, her limited or absent fetal movement that she wanted to tell us about, or her suicidal ideation. Another major issue is access to OB care specialists in smaller or rural areas. When a patient presents to a hospital with a complaint of, per se, a headache or abdominal pain, well, they treat those particular symptoms. However, they overlook those severe range blood pressures, meaning blood pressures that are greater than 160 over 110. They consider them insignificant because she's no longer pregnant. This is an oversight and can lead to significant morbidity and potentially mortality for this patient. So in doing reviews of maternal deaths, we've definitely seen this plenty.
Thank you so much, Dr. Sims. Anya and Chris Barnett.
Thanks for having us. I just want to mention the care is not intentional when it comes to Black mothers, our experiences, our birth stories, our physical and our mental health. And because there's a lack of intention in the care, we have these deplorable disparities. We're not centering Black mothers. We're not listening to them. We're not amplifying their voices. We're not replacing the safety nets that could potentially save lives. And then we're not addressing that kind of fourth trimester postpartum support that they need. So as we go on and we share these stories and we become more educated and we raise ourselves out of, the helms of poverty, we are still at just as much risk as an uneducated white woman. So we can't make our money out of this. We can't make more money out of this. We can't educate ourselves out of this. It is a complete systemic failure.
Thank you so much for your response. Sapphire?
I think in Wichita, we really have the perfect storm of things that just lead to this catastrophe. We have a food desert issue that is a huge issue on the northeast side of town. And even on the south side of town, there are little pockets of food deserts. We have access issues. I have clients who apply for Medicaid and don't hear back for 3 months. And that is a huge issue because in that time, she could have been seeking care. We are not doing a good job of taking care of Black mothers in Wichita for so many reasons. And I think it really boils down to just disregard and devaluing. We're devaluing Black mothers and Black babies, and we aren't focusing the funding where we need to. We aren't asking the community what the community needs. We're basically telling folks what they need, and it's tone deaf, and it needs to stop. And so I think it boils down to a problem of racism. Everybody at the table needs to care that Black babies and Black mothers are dying, regardless of their color.
Thank you, and thank you all for all of those great responses. So our next question is, in your opinion, how have the recent acts of inequity and the current unjustifiable deaths of Black men and women impacted Black mothers and fathers? And know that question is a lot. We'll start with Dr. Sims.
Yeah, that's a loaded question. So let me just start with the top causes of maternal death. postpartum hemorrhage, infections, blood clots, high blood pressure in pregnancy. Of course, each of these, they affect the cardiovascular system in, of course, differing levels of significance. And as it relates to COVID-19, we all know that it's an infection that affects the immune system. However, we've also seen the impact on the cardiovascular system, such as heart attacks and strokes. And we've even seen where some people actually present with a heart attack and we find that they had COVID-19. Or they present with like a pulmonary embolism, meaning a blood clot in the lungs, and we found that they had COVID-19. So we're seeing that we're having hits on the cardiovascular system as it relates to the disease. So now we put these two together. We know that the Black community is affected and impacted more for both of these effects. So on the maternal side and from COVID-19. So my concern is that among the current system where there's provider and systemic biases or limited access to OB care in certain rural areas, if we have a pregnant person that has COVID-19 and then she perhaps has leg pain and shortness of breath, which to me would symbolize that she potentially has a pulmonary embolus or a blood clot in the lungs, or excessive bleeding, or any other hypertensive disease of pregnancy. She now has 2 hits to her cardiovascular system and a system that is against her. Where can she stand? She has a provider that's not listening to her, a system that's not in place that is going to help her with 2 hits to her cardiovascular system. The odds are against her. The odds are against her baby. That's where we need improvement. I got some more to say.
Wow.
Every state and hospital should have a maternal and morbidity and mortality review committee. I remember for ACOG, which is our governing body, back in 2017, we actually went to Capitol Hill and we advocated for funding for every single state to have these review committees so that these deaths and these morbidities can be reviewed at the state level. But I think a hospital, which I actually sat on a committee as a resident at my particular hospital, where we were able to review these things. So when you have these committees and you can review the morbidities and the deaths among your mothers, it's not a point of pointing the finger at who did what wrong, but it's a point where you can say, that's where we went wrong in her care. This is a systemic issue. This is a provider issue. Now, I'm not saying that every single morbidity or issue with, poor outcome has to do with only that. I mean, we do have patients that we have a difficult time with getting to do what we would like for them to do or understanding why a particular illness impacts their care. We do have those issues too, but when we have the system on the side or against the patient already, when we have that patient that's just a little bit incompliant or inadherent to the plan, it doesn't make it any better. So anyways, you get together and you put together these, what we call care bundles that help standardize care so that you hope that the provider bias will be removed from it because you're following a care plan for a group of people, opposed to, oh, well, I'm gonna do this for her, I'm gonna do that for her. Of course, you have to, modify it a little bit for a particular patient because everyone is a little different, but at least there will be things in place where you have, y'all heard of the cheese model, where you have different holes and the person falls through all the cracks. Well, you would hope that you have a system in place where if they fall through one crack, they're not gonna fall through all the cracks and you can catch them before they hit the ground. That's the whole purpose of that. So if every single hospital has those types of things, they can put together plans and bundles or care plans so that we can better care for our patients.
Thank you so much for that. Anya and Chris Barnett.
I think about how stressful it is to get up in the morning for us. how stressful it is to go to work, how stressful it is to go to the grocery store or drive across town if you don't have a grocery store in your neighborhood. And it just reminds me of, that weathering hypothesis that Dr. Finette Thornhill Scott spoke about last week. It is just that wear and tear on our bodies. The systemic racism that we have to encounter, the lack of access to healthcare, the lack of quality education for our kids, the disparity in pay parity when we go to work, and we're working just as hard to make just as less. So it's just a matter of, it's not happening in a vacuum. It's these things that are compounding, that's rising our blood pressures. And here we are trying to bear children or come home and take care of children. We're not sleeping. We're stressed. We have heightened anxiety. I worry about him all the time. I worry about my kids all the time. I cannot just sit and relax like some people can. I am always on guard. It's fight or flight. And that is completely unhealthy for our bodies. And so when we see the unjust deaths that we have been witnessing, the George Floyds and the Breonna Taylors, the Tamir Rices, it just breaks my heart. It breaks my heart, and it just keeps rising, those levels of stress. How can I be productive and healthy for my family if I'm just so torn up from these inequities and inequalities? Did you want to mention anything?
I agree.
He's got question 3, so he's coming.
Thank you so much. That is such a great response. I myself, every time I hear the ambulance or police, I am just terrified, just in trauma if my son is not next to me because of all of the events that are happening. And we have to think about, and we have to have these conversations about how this is impacting the Black body. Sapphire?
So what I think needs to happen most urgently in this environment that we live in with COVID and racism and all of the stresses is we need the return of the village that we once had. If you look back to the history in the late 1800s, who was delivering babies? It was Black women, the grand midwives. They were delivering Black babies and white babies, but it was community-centered care. It was person-centered care. It wasn't the dynamic of, I'm a God, you're going to listen to what I say. It was more of an equal dynamic, and we need the return of that. We were never meant to birth alone. We were never meant to go through motherhood alone. We need each other. And so I think what would really change things in Wichita right now is if we could make efforts to return the village to what it used to be and to be very intentional about it. I believe in very specific tools in public health. I don't think that if we look at this from an all lives matter perspective, we're going to solve anything. We specifically need to look at giving Black women support and Black babies support. We need to support lactation. We need to support physiologic birth. And we need that wraparound support within the community. One of the things that I would love to see is more Black providers, more Black doulas. That's something that I'm personally working on, because once we have that, once we return birth back to the community where it always belonged, then people will feel supported. We won't have these inordinate stress levels. It won't be as unmanageable. We can do anything if we do it together, right? And so I think that is the most important thing. That's what we need to focus on. And we do have one hospital here that does not allow doulas. I think that needs to change immediately. They allowed doulas before COVID-19. And right now it's especially important because I predict what we'll see is a rise in these disparities just because of everything happening. And so that's an urgent matter. That's something that we can change now, and it's up to all of us to do it.
Thank you. Angela?
Well, I won't belabor the point. I think the panelists discussed it well from their perspective. Stress on the system. What do I think about these deaths? We talked about it last week. It was too much. Stress. People want us to be polite about our pain. People want us to be polite to our oppressors. People want us to be polite to people on our neck, literally and figuratively. And we're dying and we're apologizing for it. That's stressful. It's stressful to have to choose your language when you're trying to just save your life. It's stressful when you're trying to communicate to your doctor, but you better not put too much of this into it, because then you're easily dismissed and you won't be heard. It's stressful. We're talking about withering. Our relationships become stressful. We're worried about one another. We're bickering. That might happen in the home. It's a self-fulfilling prophecy. And one of the things that we keep talking about are the stressors caused by this larger mammoth pathology, which is racism. It has permeated every aspect of our life. So you want to return to a village that's not well, because racism has eviscerated it. We're still trying to get back to the family model. We're still trying to get back to our kids being educated in the schools properly. We're still trying to heal a village that was eviscerated by slavery, then Jim Crow, and now we just call their names. We don't even call a thing a thing. We just call the names of those lynched, like this is 1929 and I'm Ida B. Wells, writing it up in the paper. I wish she was here. We tell people to be polite when they're contextualizing what racism feels like for a person living it. What that does physiologically to the body. So what do I think about it? I think that our house is on fire and we better do something before we burn up in it. And I don't think it's going to be polite, but I do think it's going to mean that we must use our voice and connect these dots. What happens to African-American men, what happens to African-American women, what happens to African-American children, it affects us all. There is several African sayings, but I'm going to say two here. One is in Butu, I am because we are. So that's one thing our village and community needs to know. I can't look at my neighbor and say, oh, it's on fire over there. Oh, too bad. No, they go down, we go down, period. So it doesn't matter if they're not respectable or look the part, or they're not white adjacent. They're ours. The second part of that is the hand that rocks the cradle rules the nation. Dr. Finette Thornhill Scott said last time, and the Messiah said it for generations before, the health of a community is measured in the health of its children and its mothers. How are we doing, y'all? And I say that because, again, I will not sit here and pretend that any intervention strategy that does not include the dismantling of white supremacist systems will work. It won't work. There's babies falling into a river and you'll keep picking them out of it until you go up to the top and figure out where they're coming from. We know where they're coming from and we're afraid to call a thing a thing. We have jobs to keep. We have roofs over our head. Guess what that is, y'all? More stress. How much can I push back against the system killing me before I lose my job? And will there be a safety net there to help me? Because I'm talking about saving the life of my children. This is what I think about when I wake up in the morning. Can I go to work and when they ask me how I'm doing, really tell them? Stressful, y'all. And guess where it starts? Not when you get pregnant, middle school, elementary school. Our babies got stress in their belly on fight or flight all the time. You think that turns off just because she figured out she got pregnant, just because he figured out he's going to be a father? Absolutely not. I agreed with everything that was said here today. The only thing that I will add is, as we intentionally rebuild our village, as we intentionally train our health providers and look to measure cultural competency in health systems, as we look to center African-American women, we must also center the enemy. And that is white supremacy and anybody who supports it and stands for it, period. And all your skin folk ain't your kinfolk. That's it.
Wow, thank you. It's a hard one to come back from. Awesome, awesome responses. And thank you guys so much. So true. We cannot expect for those that are stressed every day since middle school to function normally. And we have to start healing somewhere. And first, we have to address the trauma that we're experiencing. We should not have to have difficult conversations with our young children about how others will treat them. They deserve to live a life the same as others in this country. We have paid our fees in so many ways. So we'll move on to the next question. We'll start with Chris. In your opinion, how do you feel these disparities have impacted Black fathers? And what can the community do better to support Black fathers?
For me as a father and watching my wife go through it, you know, giving birth, and when we were in there, the doctor really wasn't paying attention to her. Like, she was telling him, you know, I have a headache, I don't feel good, and being dismissive when she's telling you what's going on, that's a problem. And, you know, me being a Black man, I can't go off on the doctor, because then, you know, I'm perpetuating some stereotype, and next thing you know, I'll be kicked out of hospital or worse. But it's frustrating to watch doctors who are supposed to be there to help you and help you through this, which is supposed to be a joyous occasion because you're bringing, you know, your son or your daughter into the world, be dismissive, and you watching your wife, she can't do anything about it because the people that's for are not caring for her. You know, that's troublesome, that's stressful. That would ignite a fire in any father in that situation. So, I mean, that's one thing that when you watch that happen, it puts you in this mode like, we're not doing this again, you know. Or if you tell your friends what happened, it'll put them in a mode like, I'm never going through that with my wife. And all of this just compounds and compounds, and before you know it, you know, this may be a reach, but nobody's going to want to have babies because the hospitals aren't really there for us. The hospitals aren't really there for Black women. They're not really there to take care of them in this most intense time. They're not there for them. So, you know, we'll watch all this happen, and, you know, we won't want to deal with hospitals just like we don't want to deal with the police. The cops breaking our trust, hospital breaking our trust, we don't know who to turn to. That's it.
Oh, that's a lot. All right, Sapphire.
I think what we need to do to support Black fathers is allow them to be involved without this stereotype that so many providers display that Black dads are not involved, because that's not the case. We know it to not be the case. And we need advocacy for Black fathers too, because a lot of times, you know, in births that I've gone to, a nurse will walk in a room and just walk right past the father as if she didn't see him. And it's dehumanizing. And I can't imagine what that would be like, going to the birth of my child and feeling othered, feeling excluded, feeling made to feel like I don't belong there. And so that needs to change. When nurses come in the room, one thing they can do is ask the dad's name. He's sitting right there. Just basic humanity could go a long way.
That is so true. We need to see and respect our Black fathers because they are active. Angela?
I would just agree again. One of the things, you know, I just think about my personal experience in the hospital. It was very interesting. Most of you know me as, or may know me or may not know me, but I have two physician parents. I am not a physician. I'm an educator in Kansas, so I'm really poor. And I was on the medical card when I had my child, and it was a very, very humbling, interesting experience. But I hear so much of my story in the two examples that were given about not listening. And I had advocates in the room with me, one of which was the person delivering my child. But it was just that being a Black woman on a medical card just seemed to trip them up a little bit about how to just show some humanity. So one of the things that I think about is creating ways, a structure to sort of fill the gap, sort of close some of those cheese holes, so to speak. Whereas not only we're teaching people how to advocate for themselves, but there's somebody in that hospital. If my mother and there was another, if they had not been in that hospital, if they didn't know how to advocate for me and my child's father, it would have been a different situation. We needed that navigating partner. We needed that person to help us raise our voice at a time where I, who had just come out of major surgery, emergency C-section, could not, do it in a way. And then my child's father was just taken aback. Sapphire, to your point, our nurse, who was Barbara, lovely woman from rural Kansas, she told us this. And this goes back to training, who is training y'all? She comes in and she was a wonderful individual. She treated me respectfully and she smiled as she looked at me and my African-American partner and asked me, "Where is the dad? Is he a white man?" So she was very well-meaning. My child, is a little fairer skinned than I. And she just did not know. I think she just missed genetics that training day or the Punnett Square or whatever they're teaching now, where we learn about recessive traits and what children can look like. But the fact that these and other anecdotal things are happening is just an idea of how stuff just goes wrong. We have our own biases, our own understandings, our own ignorances, and we're well-intended. But if I had been a different person, my partner had been a different person, we could have been more harmed by that. And that's just an example of, to me, the way you're spoken to when it just doesn't matter. It doesn't matter if you'll be offended. We don't even have to consider it. And she was very apologetic. And I was like, you can be sorry and I can't accept your apology, but I just don't know why you wouldn't have known not to say something like that. And there were other things. So we need advocates at every level. When I was on the table being cut open by my doctor, a nurse rushed in to stop the procedure, to hand me a telephone, to bring a nasty telephone as I laid on the table being cut open to get my child, whose heart rate was dropping. It was an emergency. She brought me a phone to let me know that the procedure could not go on until I had a doctor on file who would take the medical card. Luckily, I had a fierce and feisty African-American OBGYN who used some derogatory and expletive language that I'm so glad she used, and got that lady out of there. Saved my life and saved the life of my child. This is everyday practice, y'all. And I had some nice advocates in the room. So in my mind, I'm just thinking, how do we, again, we're advocating, we need to advocate for fathers. But like Chris said, when we raise our voices, we're not being listened to. So what kind of systems and structures can be in place now so that when people are going in, like doulas being allowed in, like these, advocates being allowed in, because we are stereotyped and we are stigmatized and treated differently. And if you don't know to say something, you won't.
Thank you so much, Dr. Sims.
So this question actually makes me think about my husband when I had my when my story played out. And so I'm kind of answering from the lens of him when I kind of speak you through this. So Black fathers who have experienced complications of pregnancy with their loved ones have been met with significant anxiety. They've been left vulnerable because they just don't know much about the physiology of pregnancy and the impact that it has on a woman's life, let alone the complications that you add on top of it. So we need to basically continue doing what we're doing right now. This is it right here. Spread the word about pregnancy and potential complications and illnesses. We also need to encourage and empower our fathers to be advocates. And I get where you're coming from, Chris, because yes, you don't want to be deemed as the mad Black man in the room over there, but encourage them to be advocates in a way that is respectful, of course, but that gets his loved one's voice heard. I don't care if you got to go call the nurse's supervisor, or call the physician to the room. We have to do something to where we empower them to keep speaking up if they call out and no one comes. They call out again and no one comes. They call out again and there's blood all over the bed because she's having a postpartum hemorrhage and no one comes. They call out again, you know what, walk out the room and go down the hallway. I need someone to come to this room and assess my girlfriend, my fiance, my wife, because she is bleeding and she looks different than what I'm used to. We have to empower our fathers to do that, because when that woman's voice is not heard or she is unable to advocate for herself, that person in the room, especially right now, COVID-19, we can't have anybody else in the room except for one person. And that one person may be him. We may not be able to have the mom and the dad who are the physicians, or a friend who's a physician in the room, but we can have that one person. So that one person who that husband is needs to be able to get out there and say what he needs to say to get whoever in the room to see that person a little bit faster, a lot more promptly.
Thank you so much. Oh, everything is so powerful. If Black lives matter, then so do Black men's lives, Black fathers' lives,
Yes.
Black infants' lives, Black mothers' lives matter so much to us, and we will continue fighting for them. Our next question is, considering that Black women and birthing people are 3 to 4 times more likely to die of childbirth-related causes, regardless of socioeconomic status and education, in your opinion, what do you suspect the long-term impact of these higher rates of Black maternal and infant mortality will be for our communities? In other words, if we don't start to address this or put out the fire, as Angela said, what do we predict will happen? Where will we be? We're going to start with Angela.
Well, I think it is the destruction of a community. I think it was put into place historically, and I think this is the continuation of it. It's just another way in which to destroy a community is to cut off its generations, its legacies. I think you, more so than that, internally in the community, you get more trauma and all that brings. So in our education system, our criminal justice, we know about trauma. And, you don't have to take your word from anybody on this panel. You can go read some research by white folks. They've done some research that show African-American level of post-traumatic stress disorder, like those of people coming back from war. And not just adults, it's in the children. It's in the elementary age children. That's how they go to school to learn the ABCs. If you know anything about learning, it's not occurring when those levels of stressors are happening. So where do I see our future? I'm going to speak from 2 different places. One, I'm going to speak from a place of my ancestors and understanding what they have come through and what they have given us. And that, as Lucille Clifton said, every single day, something has tried to take us out, to kill us, and it has failed. So I meditate on that while I work on the issues, because I know that they're not going to be pretty. The outcomes aren't pretty now in our community. And they're not going to get any better. When women start dying in childbirth, what does that say? You can't start anything without you can't, no life can occur. I think it is by design. And I think the outcomes because in a system, outcomes are by design. You don't get mistakes in systems. That's not how they operate. You put the inputs in, you get the outputs. It's a system. So if it ain't going your way, I don't know how many questions you need to ask about if it's for you. The second thing is, we have got to start using our own tools to dismantle the system, because there is no other way for us to stop this sort of train that's sort of moving in this direction, right? We've just got to take it up off these tracks, which I think means being radical about a number of things: our self-care, our self-preservation, the way we work in communities, the way we see each other, our Ubuntu, the way we treat each other with humanity, the way we treat our communities, and all of that. Because it is the destruction of a community if these outcomes continue to go the way that they are.
Thank you. Dr. Sims?
Well, actually, just have something pretty simple, but I mean, it's a whole discussion in itself. But in the direction that we're headed, which you've already said, 3 to 4 times more likely. So in the direction that we're headed, we can anticipate a couple of things. On the positive side, more awareness, which is what we're doing, of this matter, and legislation, which, there are lots of organizations that are going on Capitol Hill and talking to their senators and their representatives about different policies that can be put in place to create systematic changes in hospitals and what we call, like I said, care bundles to help standardize patient care. So our goal with that legislation is to help us standardize this care and for the cheese model, not allow people to hit the ground. I mean, if you fall through one crack, you better not fall through another crack, because these should be in place to help us to avoid that. Our goal is to minimize the morbidity and definitely to prevent the mortality. Because sometimes we can't always, we can't play with genetics. We can't change someone's family history. But what we can do is we can catch things early and we can prevent further damage and we can prevent death. So that's on one side. And then, of course, on the other hand, if we don't start to see the improvement, then we start seeing more distrust among the minority community for OB providers and hospitals, which is what Chris talked about a little bit ago. And then that can potentially worsen the outcomes for our minority populations, because then they start to say, well, you know what? They're not going to listen to me anyway. They're just going to treat me and send me home. They're not going to listen to me, so I'm not going to go. Oh, well, this is similar to, my menstrual bleeding, so I'm good. I'm not going to say anything. Or I don't want to bother my doctor because, he or she seems irritated every single time I call. So they start to dismiss things up until the point where it's too late. And then you present to a hospital that has no OB service because you're out in the rural area. Mm-hmm. And now, not only are you at the near-death experience, mm-hmm. but you're at a hospital who can't properly take care of you. So if we do not start to see improvement and we start to see some more distrusting behavior among the African-American community, we're going to start seeing some worsening outcomes. This cannot happen. We must do something to change this.
Thank you. Sapphire?
So I think the long-term effects of this, it's complex, but I'm going to speak from the place of somebody who has lost a baby. I lost my second daughter at 37 weeks. I'm sorry, 38 weeks. And the loss of a child, there's no words. There's nothing more horrible. It is exactly every bit as horrible as any mother would imagine. It is. And it's something you never get over. And one of the things that people don't realize is that the rates of relationships dissolving and marriages ending in a divorce just go through the roof after there's been a loss of a child. And that goes back to destruction of the Black family. There are already all these factors in society, you know, the preschool to prison pipeline, the racism in the medical system, just everything that Black women face in society. And it destroys the family. And so that is the long-term cost of this genocide. I won't call it anything else. It is genocide. And I don't want to talk about it in economic dollars. It is a human cost. And these are not numbers. These are mothers. These are babies. You don't know who that baby would have grown up to be. Would he be the next Barack Obama? We don't know. Probably, you know, you don't know what you've lost out on once it's gone. And we're robbing Black futures, brown futures. We're missing out as a community every time we lose somebody in this senseless way. And so I think that's the long-term effect. Loss to the community, loss to self, loss of the family. And that's what it comes down to.
Thank you. Anya and Chris?
I think there needs to be a culture shift that these stories are important and essential to that shift. We should be sharing them to stimulate some type of action and policy change. We need to increase awareness, like what we're doing, increase access to quality health care, education, economic factors, and then going back to replacing those safety nets. And additionally, we need to hold these healthcare providers accountable. I'm always thinking about, how are you my doctor and you let me lay in this bed for over 24 hours before assessing the damage, prescribing any medication, and just fulfilling my needs? How did you get to this point to service a client? It's just incompetence to me. And it's more than cultural competency. That is important. It's also cultural humility. Mm-hmm. And we need to realize they're not very competent or humble when it comes to it. And so there needs to be a reshift in what we're teaching our healthcare providers and what we're teaching these nurses, so that it could be safety and priority first and foremost.
Thank you so much. We're going to pause here to take a few questions from the audience. Before we do that, I just want to kind of pose something. Is, you know, as we talk about doing better by Black moms and Black fathers, can we train hearts? Because a lot of this is just pure humanity. And so we need to do better. But I'll stop here and we'll take a couple of questions we have from the attendees, and we'll let each of you respond to their questions.
Hey, well, hello everyone. Can you hear me okay? All right, sorry for my location. So if you have a question and you're a participant, if you could put it in the Q&A or in the chat. I don't see any at the moment.
We have 2 questions in the Q&A.
Okay. Okay, I have them. So the first question is, this is Sarah Post with The Village, the Prenatal Support Network. This is a big question, but how can our communities do better at treating the mental health needs of Black mothers and fathers? And whoever would like to start there or would like to take a try at that question, I can repeat it if you want me to.
think that in the postpartum period, of course, we always have that, depression screen. And you would hope that it's being done at every postpartum visit. However, at least at the place that I work at, we have a depression screen, which is just 2 questions. And of course, if it comes out positive, then it comes out with like another 9 questions. And they're asking us really to just do it each trimester, because you just never know, people's situations change and things like that. It's funny because some of the residents and just some of my colleagues, they laugh at some of the social notes that I put on the chart, because I keep up with what's going on with my patients, so that when I see them the next time, I can follow up on it. And when I see something that has changed, or I see a demeanor or an affect that looks a little different, I'm like, hey, do you think that you could benefit from some counseling? Counseling is not a bad thing, y'all. So if we can, screen, or at least just ask them about what's going on at home. So when you're having your baby shower, oh, why are you not having a baby shower? Oh, you don't have no friends. Oh, nobody's, you're not getting along with people. What's going on? Where's the dad at? Is he going to be involved? I kind of get into folks' business a little bit. And it seems like my patients don't mind. So I just keep doing it, and I will dig and dig and dig. And I think that we can't be too busy to do that. And if we're not too busy and we look into the social aspects of people's lives, we get to know them a little better. They get to trust us a little bit better. But as a result, we're able to refer them to counseling or start them on medications if they need and things like that. So that's my thought on that.
Okay. Thank you, Dr. Sims. Angela, did you have something?
Just to piggyback that, I just think about my community and the numbers of people I know who need mental health services and can't get them. I think about accessibility. I think about, where do you refer to with no insurance, or nobody teach or seeing these types of patients, no community-based care that has capacity enough to actually deal with the needs, let alone competency, culturally or otherwise. Kansas, we like to snip them safety nets, the dollars and otherwise. And so for vulnerable communities, pre or post partum, a lot of times there's no access to care, period. It doesn't exist. And that's true for white folks too. The issue is that a lot of times privilege builds in its own safety net. And so people will jump to help you when you look a certain way versus when you look other ways. And so for communities of color, it is paramount that we continue to advocate. We need to raise awareness and advocate and get some policy change, period and point blank. It's just, nothing here exists to support people seeking to manage and take care of their mental health.
Okay. Anya, did you want to comment on this question too?
I'm looking for a therapist that looks like me. And in Kansas, that is a very hard task. I've just recently found a few therapists who I can connect with on a cultural level, who I feel it will be long-term, because a lot of therapists are from here to there and everywhere, depending on where they are in their career. And then somebody who's gonna believe me. I don't have to keep telling you that I'm suffering from heightened anxiety. I don't wanna have to keep telling you that I'm physically in pain. I wanna make sure you understand, Black people don't just have a high tolerance, a high threshold for pain. I hurt like everyone else hurts. So it's been difficult to find a provider who just has these basic needs that I want. But then also, if my insurance will pay for it, if I have enough money that month to pay for it, if it can be couple or family, can I include everybody? I don't know. And it's been very difficult. Everyone in my family goes to therapy, except us. We have to balance our mental health because our insurance isn't that great. It's extra money out of our pocket. So then we have to figure out where we're gonna cut the expense here or there to support it. And then in the end, we just don't go. And it's not a stigma thing for us, which I know for some people it is a stigma thing. But I want at least our kids to know that their mental health is important. And so they have therapists, they go weekly, not to mention the stress that they have being in a school system that is not designed for them, being in an environment of America that is not designed for them. So I think it's more than advocating us to get the help. It's advocating for that policy change and that access for us to go, and ensuring that there are people who look like us who are an option.
Okay, so it sounds like and then we're going to move on to our second one. So, but it sounds like we're needing to maybe increase the awareness of the resources that are out there, because there are some therapists of color. I'm not sure if they market themselves well. So, okay, let's move, Angela, and we'll catch you on the second question here. All right, so the second one is, as a white woman who will be a medical provider in less than a year, what advice do you have for me to be able to effectively advocate for my white patients and help overcome this disparity?
Yeah, let me talk to her. I don't know if that was a typo.
I think it might have been a typo. Yeah.
Yeah. Okay. So right now in this space, we're talking about Black women issues,
Right,
and what's affecting our community. Honestly, your white patients are going to be fine, because when you go in there and the white woman is on the table, you're going to acknowledge the white boy that's with her, and you're going to acknowledge every white man in the room.
right.
The white woman says she has a headache, you're going to hop right into action, and it won't be a problem. So that's
Right.
not really a concern. Like, Black women don't get that same kind of
Advocacy.
yeah, they don't get that kind of advocacy. And
Right.
advocacy for your white patients is going to come naturally. I don't mean to
Yes.
be rude asking if that was a typo or not. But
It is. Yeah,
Oh.
I didn't want to interrupt you, Chris, but she said she meant to type Black patients. That was just a typo. Technology. So yes, it was a typo. So she's wanting to know, what can she do as a provider to advocate for patients who look differently from her or who have a different cultural background. So what would be some advice from a patient perspective, and then also from a provider perspective? Okay, I'll be quiet. You guys can answer.
Do everything I just said.
Okay.
Do it for the white patients, do it for the Black patients. Listen to the white women,
Right.
acknowledge the Black men that's in the room.
Mhm.
And if the just listen to the Black woman. That's it. That's all you got to do.
Believe her.
Black woman is saying that something's going on. Listen to her. Take it serious. That is all, and that's it. Just
Good
listen.
advice. That's excellent.
And then
Anyone else?
also hold your colleagues accountable.
Yeah.
Okay.
Who
Yeah.
you're working with, check in with them,
Hmm.
on them. They need to be doing the same things that you're doing. They need to have the same concerns that you have. There needs to be some type of accountability, and it starts with colleagues and cohorts.
And then ask questions in your training. You know, I don't go to physicians who I feel haven't had a background in cultural competency. If everything around you look like you, I just don't know that you could do anything else. So take the time to, in your training, ask questions. If all the research that's being presented, if all the case studies y'all talking about, don't nobody look, is no person of color, you know, we don't think something's wrong with that data. We don't think something then may be wrong with how you then go try to execute patient care. So be humble enough to know that you're going to get trained and you're going to be dumb. It's a lot you don't know. And that you have to go into those rooms, like they were saying, and not just for people of color, for everybody. And you have to listen, because our trainings are full of biases. We talked about this last week in the race medicine and race science. And half the people who started the medical institutions were performing gynecological experiments on Black women's body without anesthesia. So be intentional, like Anya said, and be human. I have never, racism is real, it has impacted my life. And I'm an educator, and I have never looked at a white person and been like, I don't want to teach you well. I don't want you to know nothing. I hope you don't get out of here. I just can't find it in me. It never even crossed my mind. So I don't know what's crossing y'all's minds or not, But I do know, treat people like human beings, period. Like it was your daughter, your mother, your grandmother. Treat people like you want to be treated, period. Advocate for them.
Excellent. Excellent point. Okay, Charlotte, I think unless we have no more questions, do you want to move on to your next section or? Okay.
Yeah, thank you guys so much for that. That is true. I mean, one way to reduce your biases is to put yourself in that person's place when you're caring for them. What would you want? All right, panelists, we're going to start this with Sapphire. From your perspective, what is your unique role in addressing these disparities?
So my role is focused on the return of the village. I want greater representation in all birth care roles. I want Black OB nurses, brown OB nurses. I want Black OBs in town, more of them. My role is advocating for that because I already said this before, but until we take birth back, nothing is going to change. And as a doula, I see so many things that are disheartening. I've seen so many instances of abuse. I could sit here and tell you stories for hours, and I can tell you that this system needs to change. But until we have that infrastructure where we have a critical mass to work on this issue, I think it will be difficult. And so that's what I'm focusing on right now, is bringing more Black women to the table to work as doulas. A doula really is kind of a magic tool. It is amazing what a doula can do. Just having an extra set of eyes there for accountability and telling folks that you're going to hold them accountable changes things. And I think we need more doulas. And I see that as my contribution to this is we need more doulas in Wichita. And so I'm going to make it happen.
Anya and Chris?
Thanks, Charlotte. I am coming from just a community advocate. I want us to celebrate and honor Black womanhood, Black mothers, and that's everyone on the spectrum, not just the binary women that we think about and the binary families that we think about. This is a public health crisis. I want service providers, advocates, academics, healthcare professionals, community activists, doulas, students, youth. I want everyone at the table, and I want Black women to gather, committed to the equitable care for Black families.
You, Angela?
You know, I agree with that. One of the things that I've been marinating on is, connecting the dots, but also just, we talked about, this idea of cultural competency, and I heard culture shift earlier. We were talking about Sedgwick County, we're talking about Kansas. We got to be real about Kansas. Most Black folks who live here do so on a grain of salt or whatever the thing is. You got to look hard to find them. You got to look hard to find everything. It's a place with so much rich history, diverse history, and so whitewashed. So whitewashed. So one of the things I'm gonna say is, how are you gonna recruit physicians, competent healthcare workers to come live and play here to serve your clients? So even in that bigger issue of policy change and advocacy and awareness building, there must be a culture shift, because I will tell you, I understand why people want to get their stuff and get up out of here, particularly if you're young and Black. There's not very many options. Even if you do everything right, you could end up, we don't even have to go there because we all know the stories. So we really need to continue to advocate from the grassroots level all the way up to the people recruiting businesses and people to come into our communities to make sure it's a place where competent health professionals who can treat us the way we should be treated want to come live, work, and play. This needs to be a place where they get some payback for their, come work in Wichita. I know it ain't a rural community, but it's something. There should be if you go to a place that has desperate health conditions as a Black worker, you should get some of them loans paid off. Something to increase people coming here. When my parents left, I know, Michelle, you said there are people here. When my parents left, you no longer have an allergist here. You no longer have a Black allergist here. You no longer have a Black peds person here. 2 people moved out and you have nothing. That's Kansas. And when they came, you would have thought it was the second coming. I'm not trying to be funny. Because people are not coming here and staying here and leaving their gifts and talents for us to all to reap the benefits from. And so that is a big part of that culture shift as well. We have internal work to do in our community, but we need to be talking about what it's going to take to recruit and keep people here for a certain quality of life.
Great, thank you. Dr. Sims?
Well, as an OBGYN and a mother who has experienced significant morbidity with high blood pressure and pregnancy and a preterm birth, I kind of speak through a triple lens: a physician, a mom, and a NICU mother. A patient and a NICU mother. As a patient and a mother, I remember as things were happening, everything happened so quickly that I had a difficult time processing what was going on. And I figured, if me as a person who saw these things happen on a daily basis, if I had a difficult time processing it was, just think about what it would have been for someone who is not even a part of the medical community. So as a result, as a physician, my goal is to make sure that, 1, I listen. 2, I provide unbiased care. You are human, not a person of color or a person, whatever. I remember someone saying to me, "Dr. Sims, how you got all these foreign patients?" And I was like, "What do you mean?" "She's a patient. I work at Jackson Hines Comprehensive Health Center, and we see all people. And I'm not going to come here just for one race of people. I come here for all the patients that I can, period. I'm going to speak my Spanglish to get you through a delivery. I'm going to hop on the language line to get you through a delivery for an Arabic patient. I'm going to hop on another language line to get you through a delivery for someone who speaks Punjabi. You're my patient. And that's what I'm going to treat you as a human being, because you're my patient. And so if I have to take a little extra time to explain it to you on a language line, opposed to me just trying to talk to you in my English language, and I know that's not your language of choice, like they said at our health center, it is your civil right to be able to communicate in your primary language. And every time I decide that I'm gonna go try to talk to someone who I know speaks English but prefers Spanish, I say, wait a minute, it's her civil right that I go call the interpreter, or I get on the language line to communicate with her. That's her civil right. So for me as a physician, that's my unique role, to be able to explain things in the native tongue to help them understand what's going on, and then provide ample time for questions to be asked. Now, whether that means them asking their questions now or giving them a little bit of time to process and then come back even later to ask the questions, that's what I have to do.
Thank you so much. We're going to go into our last question before we go into Q&A again. And the last question will take a little thought. It's just, what is the path forward? And why is it important for us to share our maternal and paternal stories and create a platform for us, by us? And while you think about that, I want to just mention what a colleague of mine mentioned the other day, Dr. Melva Thompson. She said, you can't do it without us. No matter your training, no matter your exposure, The message should be, you can do it, but you can't do it without us. Stop leaving us out. So now that we think about those things about not doing it without us or for us, by us, what is the path forward? How can we continue to solve this issue or continue to address it? What can we do better? I mean, just as a people, as a community, as a healthcare, as a system, what is the path forward? And we'll start with Angela.
Well, I think we've said it here. Continue to raise awareness, advocate, and that means raising our voices. And that means at every level. We should make space for Black women's voices. And if you are doing this work and Black people are not at the table and have a voice, you should stop. Because what are you doing? How do you even know what you're doing? If you have not spoken to and got input from, and the people in the community are not the designers of the research or the questions you've asked, that this doesn't make sense to me. That sounds like more of the same, paternalism and things that are not going to work. So where do we go from here? We got to fight, y'all, but that's nothing new. Every day you wake up is a revolution in itself. And so we need to continue to fight for our right to live, to breathe, and to pursue happiness, to have babies without the threat of them dying prematurely or us dying. That is my basic right, and I'm going to continue to fight for it and for that of my fellow sisters and brothers through continuing to raise my voice. And we all have to do that in the ways and in the domains that work for us. Look, my child is raising her voice. She knows the power of raising your voice. I'm about to be on mute.
Thank you, Anya and Chris.
Yeah, the path forward is just keep talking, keep calling out when these things happen, keep calling out when doctors and healthcare providers aren't listening and aren't taking, Black women serious, not taking their health serious, whether it's physical in this instance or mental. Just keep, we have to keep calling them out. Black fathers keep happening. We have to be involved and we have to be there. We have to stand behind our women, stand there for our children, our future children, everybody. We just have to keep being involved. We have to keep being in the community, keep being in these doctors' offices and the labor and delivery rooms, just everywhere. We just have to keep being present, until these changes come about.
I just say do everything with intention. We need to center the voices of Black women, Indigenous women, vulnerable women, and they need to be at the table.
Dr. Sims?
Y'all, we're doing it. This is the way. If we do not share our stories, the first time someone hears about a complication of pregnancy leading to a maternal or a newborn death will be when they're experiencing it. So we have to shout the words loud and clearly. We have to get this message out and abroad. We have to do this in a way for us to avoid problems and, of course, catch them early. I've been saying it all the time, like we can't prevent everything, but if we catch it early, we can prevent a maternal or a fetal or a newborn death.
Thank you. Sapphire?
So I think context is really important on this. I think as a society right now, we're at a turning point. When Emmett Till was killed all those years ago, it changed the civil rights movement because his mother chose to have an open casket. And everybody could finally see the wretchedness, the awfulness of what racism has caused and continues to cause. We have to call a spade a spade. You know, you told me the other day, Dr. Smith, we can't use bias when it's actually racism. And I totally agree with that. It's racism. It's the elephant in the room that makes people uncomfortable. But until we can discuss it, we can't face it. We can't change it. And so we have to talk about our stories. We have to all be at the table, and especially Black women. We cannot discount Black women's voices in a Black woman's matter. It's not fair. Black women deserve the biggest seat at the table on this issue. And so I think as a society, we owe it to Black women and Black children and Black families and Black futures to keep calling out the elephant in the room and call a spade and acknowledge what racism is doing. It's killing people. They can't look away from this for much longer. Our society is changing. People are recognizing what's happening. And, you know, when everybody steps back and has that quiet moment of realization, whose hands have the blood on them? That's my question. And so I'll leave it at that. We have to expose what's going on.
Wow, thank you. So such great responses. We definitely have to, if we're going to move forward on this issue, we got to get comfortable with being uncomfortable. We're going to have some uncomfortable conversations, and it's okay to be uncomfortable until things change. When things change, we can then have some comfortable conversations. But right now, get comfortable with being uncomfortable, because we need it to stop. We need you to stop killing our Black men, because we need them in our community, and we need our Black moms and our Black infants to survive birth. It's 2020. We need it to stop, and we need to stop doing this work without the voices of our Black mothers and Black fathers, and we will no longer stand for it. We will now have our call to action by Dr. Michelle Redmond, and then Q&A.
All right. So there was only one other question there, just saying excellent point, Sapphire, and thank you to all the panelists. So for the Q&A, just for the call to action, so one of the things that we're doing here is having a Kansas Birth Equity Network. And when we think about the word equity, it makes us think about the word health, the two words actually, the phrase health equity, which means that everyone has the opportunity to attain their highest level of health. And we want to think about that in the same way for birth equity, that every mom, every expectant baby, they have the opportunity to obtain their highest health, to be born, to make it to that first year of life. So when we think about the high infant mortality rates here in Sedgwick County. And so what I really heard from all the panelists, and this was a great discussion, I heard that we want our voices, we don't want to actually always have to worry about being polite with our voices, but we want to be direct and say what we need for our health and for our family's health and for our community's health. And when we think about providers, we want providers and doulas who look like us, who are in the community, who reflect the community, the values of the community. And then we also want to really think about stress and the heavy weight we have of concern. And, you know, when we think about mental health, and especially African Americans, this is something that we always don't address. Well, technically we don't address it at all, really. But so there, you know, it's really time to think about, you know, how do we address mental health? How do we address stress so they won't affect our health in such a drastic way? And we want to support our Black fathers. We want our Black fathers to be advocates, and we want them to be able to have advocates. We want them to be respected for their advocacy and encourage them to be advocates. And we heard that from Chris, that we want to listen. We need to make sure that African American fathers are listened to when they attend those appointments, that their points are being taken, and also that there's not a break of trust. And I think once you do break trust, you have issues, and it's hard to rebuild that. So we want to make sure that we can always continue to have a bridge of trust when we think about providers, or we think about different services that moms and fathers need, and the family needs in general. So basically, we want you to listen to our voices. We also want to think real quick about making sure we have health navigators and we have partners, and that we can address microaggressions when they occur. Because that can also be another level of stress, deciding how to address it, when to address it. And especially if you're not feeling well, or even if you're going into the hospital, it's hard for you to always have to be able to be the one to address those microaggressions right on the spot. So we want to listen to our voices, which is what the Kansas Birth Equity Network wants to do. We want all hands on board. We want to be able to capture moms' voices. And so one of the things I'm going to do right now is share my screen, hopefully. Okay, can we everyone see this flyer? So your voice matters. And one of the things we're really wanting you to do, we want you to get involved in the Kansas Birth Equity Network. If you're on the call, if you know someone who might be interested, reach out to them and reach out to Charlotte Smith, who's leading this project, Kyla, who's our research assistant, I think she's still on, or myself, or anyone on the panel, Angela Scott, our co-lead, and any of our panelists. I think if you know them, you can also reach out to them and we can just connect. But the Kansas Birth Equity really wants to learn how experiences of bias and racism and mistreatment have impacted your care in the community and even during your pregnancy. And so I do want you to be able to see this flyer. Go ahead and scroll up and down. If you're interested in having your voice recorded and telling your story, you can, this may be hard to see, but you can go to this website, and you can also email Kyla for more questions and also call her at 293-1816. And we do want to be able to provide you an incentive for your time, but we really want to hear your voices. We want to hear how you've been impacted, how racial discrimination or even chronic stress has impacted your experiences of pregnancy, your birth outcomes, maternal and infant outcomes. And we really just want to be able to take these stories, learn from them, so we can build a really strong Kansas Birth Equity Network, and so that we can have some really improved outcomes in health. And ultimately, I think our goal would probably be, we're thinking about to health equity, but also we want to be able to eventually reduce this infant mortality rate here in Kansas. So that's our call to action, is join us. If you want to be a part of this and you want to record your voice and tell us your story so that we can learn from you and then we can work together, we also would really appreciate that. And so I'll leave it there. Charlotte, I'll go ahead and stop there and I'll let you go ahead and continue.
Thank you so much for that call to action. So we're close to ending our time, or past ending our time. And I just want to, before we go, I want to thank all of the panelists for participating. We are so grateful to have you as a part of this project and as part of this work. And we truly appreciate your time and efforts, your voices, your expertise, and your advocacy. Keep doing what you're doing. We need you. I also want to thank every person that attended, whether they were on Facebook Live or they were on the Zoom call. Thank you for coming. This is where we start to make change, when we start to have conversations. This is where it begins, and we will continue to do this work. I want to thank my colleague, Dr. Michelle Redmond, for believing in this initiative and helping me to move it forward. And all of the fraternity and sorority members in Wichita, Kansas that meet with us on a monthly basis, because they believe in this work and they want to be a part of the solution. And all of our partners, we're so grateful for you. But I don't want to leave this without some words of wisdom to each and every individual that has participated today. So I'm going to give our panelists a minute to just give you a last word of encouragement or either a call of action as we end this conversation. We'll start with Anya.
Mine is short and sweet, and that is amplify the voices and the stories of Black women.
Chris, do you have some final words?
Stand behind Black women like I'm doing right now.
I love it. Angela, final words?
Aluta continua, y'all. The struggle continues. Get into it. We're in the fight for our lives, and we can do this.
Sapphire, final words?
Together, we can fix this problem. We need everybody at the table. We need our white allies too. This is a problem that should concern all of us. This is our community. And I would love to see everybody on this call take ownership and do something tangible this week. Donate to an organization that's serving Black families. There are so many. But do something. Don't just keep your concerns to yourself. Do something, because we need everybody at the table right now. This is a huge problem.
Dr. Sims?
I think I'll speak to my colleagues and say that we all should hold each other accountable for taking care of all patients, because our patients are human beings and we are caring for human lives. We cannot continue to avoid caring for people because of the color of their skin or where they from or their tongue that's different than ours. We have to do better.
Thank you, thank you, thank you to everyone that has attended. That is so true. We need you, no matter the race, no matter the gender. We need you in this fight. And we're asking you to stand with us, to stand by us, to advocate for us, because when our Black babies, when our Black moms, when our Black fathers win, when they're healthy, our community is healthy. And it takes a community. So we need you. Stay with us. Continue these conversations. Join us in this fight. Thank you so much for your time. Are there any final words from Dr. Redmond or Kyla?
No, this was great. Thank you, everyone. Learned a lot and looking forward to doing the work.
Thank you to all the panelists. You all have very different perspectives that I think they were very great to hear. So thank you.
Thanks. Have a great night. We'll be in touch.
All right. Bye-bye.